Welcome to today's GNCC Espresso Live with our distinguished guest, the Acting Medical Officer of Health for the Niagara Region, Dr. Hirji. Dr. Hirji, thank you so very much for being with us for the next hour. And to all of our participants, it's really glad that you were able to join us and that you're able to join us for the next hour. My name is Mishka Balsam and I will be your moderator. Since launching our webinar series, we've spent much time on looking at the economic impact of COVID-19, the information and subsidies needed, tax and legal implications to changing health guidelines, and we have heard from business leaders about the measures that they have put in place to strengthen their business. While organizations and governments are responding to the ever-changing pandemic impact, businesses at the same time have questions, and we're privileged to have Dr. Hirji agree to join GNCC's Espresso Live series on a monthly basis, especially during these critical times. Businesses are committed to keeping employees, customers, and suppliers safe, while at the same time planning and being prepared for what might lie ahead. And to do so effectively, information is critical. Often in advance of this Espresso Live webinar, you, our audience, provide us with questions, and please know that we're committed to getting to all of them today. If you wish to enable live transcript, please refer to the bottom of your Zoom screen for that option. It's enabled on our end, but if you do have any difficulties, please utilize the chat function and we hope to be able to assist you. We're going to start out with Dr. Hirji providing us with an update, and following that, we will have our interactive Q&A session. And on that note, Dr. Hirji, may I move the webinar over to you for your monthly update?
Thank you, of course, once again for inviting me to come speak with you all. I really do appreciate the opportunity to have an audience with all of you and make sure that we're all connected as we work through this pandemic and hopefully getting much closer to the end of it. And as well, I really appreciate when you send your questions in advance so that I can make sure I give you the best possible presentation, because I really do try and customize some of what I present to what you've shared. Apologies, just a second here. The technology
this gives me an opportunity actually to thank our audience too for submitting the questions in advance. We usually start getting questions in about a week in advance. Which helps us on our end too in actually understanding and better understanding the challenges and priorities that businesses are facing. So it's, I think, Dr. Hirji, it's helpful on both ends, and really my personal thanks to everyone who is with us today, because it does really change the dialogue that we have on a monthly basis and the priorities of what is important to you. So really, we do appreciate it.
Great, and hopefully now the slides are showing correctly up front.
There, I can see, yep, the slide is there.
Okay, excellent. So let's get started. So I think everybody is likely aware of what we've been seeing in terms of the trend in the province, where in past months, I've shown a relatively positive picture where cases have been on a slow decline. Unfortunately, as you can see here, we have seen cases start to pick up a little bit of late. And I'll go a little bit into more detail around that, because I think that's going to be a really important part of what everybody wants to learn about today. When we take a look at the Niagara curve, I think you're seeing similarly, we had that uptick. A little bit of good news here is that we do seem to be flattening out that increase right now, and I'm hoping that'll be something that's sustained. And I think we can get the first hint of what might be going on here when we look at the timeline of what happened. And I'm actually going to jump back to last year around this time. Last year, I think it is October 9th or so, was the Thanksgiving weekend. And I've often spoken about it's, a 2 to 3 week gap after something happens where you're going to see cases show up and see an increase in cases. Or if you do something to bring cases down, it's a 2 to 3 week gap before you see cases come down. And when you see the Thanksgiving weekend last year, and you have about 2 to 3 weeks after that, you could see a jump in cases coming up. And I think we've basically seen the same thing occur this year, where after the Thanksgiving event, of course, an opportunity where lots of people met, spent time together, socialized, we are seeing a little bit of an increase of infections coming out of that. I think we did need to have much more of a normal Thanksgiving, and thanks to vaccination, I think it's something that we'll hopefully be able to control going forward. But there's no doubt some families where you had unvaccinated people who are part of that gathering, there were groups who are unvaccinated getting together, and that has probably fueled some of the increase that we're seeing. And I'll get in a moment to what the other part of that I think has been. Just to show you here that what happens when you say, in the December period where you could see cases going up again. And last year we had a lockdown, and of course, the 2 to 3 week gap fit perfectly with us being able to start to bring cases down with that lockdown. And I'm really expecting that we are not going to have to see another lockdown coming. So cases are going up here in Niagara, and I'll just show you quickly here a group of other local public health agencies. One's nearby us here in Niagara, as well as a few other larger, urban centers like Middlesex, London, or Ottawa, who I also consider to be a bit of our peer region. And this is sort of the pattern that we've seen. And you can kind of see that a lot of the lines are trending up on this end. You can see Haldimand, Norfolk is actually having quite a sharp increase. Brant County, quite a sharp increase. We have had one of the larger increases, though not quite as sharp as theirs are. And as I mentioned, we now seem to be starting to flatten out, which I think is a good sign and hopefully one that'll be sustained. When we take a look at hospitalizations by Niagara Health, you can see that with that increase in cases, we are starting to see that hospitalization number trend upwards a little bit. And hopefully with the flattening in cases, we'll see that flatten out as well. Not so much of an impression here, though, when we look at our ICU numbers. And the Ontario Science Table came out with their latest modeling just this past Friday. And you can see here that they're showing that there's an increase in cases. And then they're laying out what are the 3 scenarios of where things could go from here. And unfortunately, it's a less positive scenario because we are looking at perhaps increases. I think it's important, though, to note that this was the wave we just went through where we peaked in September. And we're looking maybe in the range of being in that range or higher. They haven't shown the 3rd wave here, but the 3rd wave, of course, we had cases getting into the 2,500. Actually, I think we had days were as high as 4,000 cases. So we're not really looking at that kind of range yet. I think it's hopefully going to be something that's going to be much more manageable and hopefully something that we'll be able to bring back down and bring under control. And I'll mention a little bit more about that next. Obviously, part of what's leading to this increase is also colder weather. So we're spending more time indoors. That's more opportunity for us to socially interact and spread infection between each other. It also allows aerosols that we may breathe out to kind of gather and be contained within 4 walls and a ceiling, as opposed to the outdoors where it can all float away, limiting our exposure. Of course, the province has lifted some of the capacity limits, which I think has been very helpful for local businesses trying to recover. But of course, this is perhaps some of the cost from that as well. And looking ahead to this final slide of what the Ontario Science Table talked about, I think there's a couple of really key messages here. First off is that while testing is flat, the percent of tests, so the percent positivity, is rising. So that indicates that this is a true increase in cases that we're seeing. Of course, vaccination remains our most effective protection. We're seeing that in Europe, in other provinces, such as Alberta and Saskatchewan, as I've talked about, there is still the potential for hospital admissions, ICU occupancy, and deaths to rise quickly. So we do want to keep this under control. But I think also because we have cases relatively not too high right now, if we do have time to get it under control, and if we get it under control, we can hopefully avoid any kind of severe impacts on our local businesses and really any kind of onerous new business restrictions. That being said, the pause on further reopening and further limiting of capacity limits, they say was the right one, and I fully agree with that. And policies that support mask wearing and getting more people vaccinated will hopefully be able to help us get through this and get cases back under control without necessarily having to bring in new economic restrictions this time. So I'll move on and just talk a little bit more about what we're seeing when we dive a bit deeper into our cases. And I think this is going to be a slide here that really looks at different age groups and what we're seeing in terms of the cases per 100,000 in those different age groups. And this is looking, pandemic wide. And I think you'll notice that with the increase here that we've seen lately, it's this orange line that's going up. Not as much of an increase in any of these other lines, but this orange line is about 3 times higher now than those other lines. And that's our age group of children who are less than 12 years of age. less than 12 years is significant because, of course, that is the age group that is not yet able to be vaccinated. And that's where we're seeing an increase in cases. And so going back when I talked about, I think Thanksgiving gatherings might have had some of the potential for why we're seeing the increase in cases right now. I think, unfortunately, those Thanksgiving gatherings may have seeded infection in the young people who could not be vaccinated, who did not have the benefit of protection and vaccination, and that's caused cases to rise. And then, of course, children are interacting with other children in schools, in their extracurricular, in their athletic and sports activities, and that's fueled the increases that we're seeing. If we take the children out of that, we actually probably don't really have much of an increase in cases right now. And so this is very much, I think, driven right now by what's unfortunately occurring in children. To take a little bit of a different look, I'm now going to zoom in on a bit of a more finer grain breakdown of the different younger age groups. And this graph is starting from July. So it's not looking at from the full pandemic, but starting early July, which is when we were starting to reopen and when we were at our minimum in terms of cases. And you can see it's a pretty messy graph. All of these age groups were pretty mixed in for quite a while. But you can see lately over the last few weeks, this yellow line has really separated from the pack. And that's that 6 to 11 age group. So again, the group who can't be vaccinated, but also the group who is actually in elementary school. When we get down to preschool and even kindergarten, we're not as much picking up that. It's possible maybe we're missing some because parents are less likely to test children in these ages. But where we're definitely seeing the increase is in the 6 to 11 age group. And again, you can see here, this is 3-4 times higher than the rate of cases we're seeing in any other age group. And so sadly, it does seem like, this has been the pandemic of the unvaccinated now. And this age group who cannot be vaccinated is where the pandemic has now really started to center and really impacting most heavily. This isn't just a Niagara phenomena. The Public Health Agency of Canada reported out a couple of weeks ago that children under 12 now count for the highest number of new COVID-19 infections. And even when we look around the world, this is data from England, which I've previously shown. This was only until early October, but you can see in their trend, all of these lines are pretty flat, slight increases in some. The sharpest increase again in the 7 to 11 age group. And it sadly is, I think, children who can't be vaccinated, but who are in school, who are around lots of other people, who are going to be participating in sports, extracurriculars, going to be in contact with lots of others. They're unfortunately now at the most risk of getting COVID-19. If we take a look at where our outbreaks have been occurring lately in Niagara, looking really over the last month or so, I think we kind of see some of that pattern here as well. This yellow piece of the pie here is the education sector. And you can see there's a lot of infections happening within the education sector. So schools, childcare facilities, that seems to be where most outbreaks are happening. And that just makes sense because that's where those children who are 6 to 11 are. And so unfortunately, that's where we're seeing outbreaks. You'll notice this gray slice of the pie here, which is athletics and sports. And the majority of the outbreaks we're seeing in athletics and sports are actually in youth athletics and sports. It's, again, the younger groups who can't be vaccinated, or in the teens where they can be vaccinated, but they have lower vaccine uptake. That's where we're seeing most of those outbreaks. The other outbreaks we're seeing, I think, are some of our usual suspects. In past months, I've talked a lot about workplaces, and workplaces remain a key area where we are seeing outbreaks. Likewise, here with healthcare facilities, we are unfortunately seeing a few outbreaks in healthcare facilities. A bit of good news I'll highlight here is this blue bar here, which is food services, which has been an area where we're seeing infections and outbreaks. There's actually not been any outbreaks in the past month in that sector. So great work by them. Hopefully that is recognition that they may have done some things to help get more of their staff vaccinated, and that's hopefully keeping them safe. And hopefully we'll see that number stay low, so we don't need to see any reintroduction of capacity limits or any new measures on them. I'll just quickly mention here also places of worship have tended to be a place where we are starting to see some outbreaks. And often these are in places of worship where there's less enthusiasm about being vaccinated, and certainly do recommend that if you're involved with any place of worship, if you're able to encourage them to encourage their parishioners to all get vaccinated, I think that would certainly help us address this other area of spread. So with school outbreaks making a big part of what we're seeing, of course, there's lots of children in school who are cases. And I just want to give you kind of the summary of what we've seen over the, since the start of the pandemic. So we now have about 304 cases that have at some point been linked to a school. That means they may have gotten infected at school. Might mean they got infected outside of school, but showed up in a school while they were contagious. You may remember that the last month, I think this number was around 160. So that shows you in the last month that we've almost doubled that number, I think. And that's, I think, pretty significant and shows just how much the infection has really picked up in that younger age group, unfortunately. In past months, about 15% of our cases were linked to a school. That's now gone up to 18%. And that implies, of course, in the last month has been quite a bit higher than this to bring the average since September up to 18%. That 304, actually, this is an error. I forgot to update this slide. This number of contacts is now over 5,000 contacts in schools who have been exposed to infection. We've had close to 100 schools now that have impacted by COVID-19 with someone showing up at some point who is infectious. And we've had a total of 27 school outbreaks. And again, this number was closer to about 15 or 16 last month. So we can see that we've almost doubled the number of outbreaks as we've seen a big increase in students. And I'm just going to zoom in here again on the age under 12. So this is schools and childcare. And in that group, we've seen 205 infections. And so I just showed you 304 infections in schools total. 205 are in our children who can't be vaccinated. So absolutely, the group who can't be vaccinated is at the greatest risk. And then if you look at the contacts, I mentioned there's about 5,000 contacts in schools. About 2,800 or so of those contacts are in this underage 12 group. And of course, these students are all unvaccinated. So when they are a case or contact in school, when there's been a case around them, they sadly now have to isolate. They have to stay home for a period of time, which is of course disruptive to their schooling, but also disruptive because a parent is probably going to have to stay home and take care of them. And if that parent can't work from home, that means that parent is going to be missing work. And that, of course, is going to have an impact on many of you in the audience here who may have a business where your employee now has to stay home to take care of a kid. And even if that person is able to work from home, they probably can't work as efficiently when they need to divide their attention to taking care of their child who is isolating at home, helping them log on to online learning and the like. And so that's the real, I think, one of the real impacts of having this infection spreading in the under 12 group is that a lot of children are having their learning impacted and a lot of parents are having their ability to work and go about their lives impacted by having to be home to take care of those children. Just quickly showing you where the school cases have been occurring by institution type. Obviously, since most of those infections are in the under 12, it's overwhelmingly in elementary schools where we're seeing that. So, the under 12 is, of course, been the area where we've seen the lowest vaccine. It have no vaccine uptake yet because children aren't yet eligible to be vaccinated. The good news is, of course, that the vaccine is hopefully on the horizon very soon for that youngest age group. Just taking a quick look at the updated data here for other age groups in terms of vaccine uptake, the orange line being first doses, green line being second doses. You can see we now have about 85% of people who can be vaccinated are fully vaccinated. And the proportion of people who are choosing not to be vaccinated is actually a shrinking percentage. We're almost at 88% of people have gotten at least one dose. So there's really only about 12%, 12.5% of people who can be vaccinated who have chosen not to get any doses of vaccine. We're seeing really high uptake in our eldest age groups who now, of course, are able to get booster doses as well, or will soon be getting to their 6-month point where they can get booster doses. We have a little bit more work to do with some of these adult groups. And we, of course, want to make sure we get the vaccination rate up in these youngest age groups, especially I think the 12 to 17 group, because that's another group of students where there is still a risk of them being infected. And soon we'll be able to add another line here, which will be the 5 to 11 age group and seeing infections going up on them. And I just want to finish off today just talking about the importance of us making sure we vaccinate that 5 to 11 age group. I've already just showed you some statistics on what we're seeing in terms of schools, in terms of children having their learning disrupted when infection is spreading amongst them in that 5 to 11 age group. So that's definitely one of the reasons why we want to vaccinate that group. so we can keep them in school, they can be educated, they can have their parents be able to return to the workforce and resume their normal lives. That is all going to be enabled by getting that group vaccinated. But I think there's also some real health risk to children under the age of 12. You know, I don't have data that's broken down, but this is the national and provincial data on severe illness for persons who are 0 to 19 years of age. In Canada, there's been close to 2,000 hospitalizations from COVID-19 in that age group. 241 people in that age group have been in an ICU. And most tragically, of course, 17 children in Canada have passed away from COVID-19, 6 of them in Ontario. Again, I don't have a breakdown of how that looks in terms of the under 12s versus over 12s, but we absolutely do know that some of those deaths have been in persons under the age of 12. Waterloo Region about a month and a half ago reported out that they actually had a child who was under the age of 10 who passed away from COVID-19. And that's one of those, you know, sad deaths that we've seen. And so one of the reasons we, of course, want to vaccinate that 5 to 11 age group is that while they don't get severe illness as often as maybe older age groups, sometimes they do. And we want to prevent those severe outcomes, be it hospitalizations and especially deaths. Just want to pull up this data here. This is data from the US CDC when they were going through their approval of vaccination for 5 to 11s. And they're comparing COVID-19 in that 5 to 11 age group in terms of how often one of those children is hospitalized for COVID-19. And that compares to how often a child was hospitalized for influenza or chickenpox or hepatitis A in the years before we had a vaccine to support them and protect them. And you can see chickenpox was very similar in terms of its hospitalization numbers to what COVID-19 has. Influenza maybe a little bit more in terms of how often children are hospitalized from that versus COVID-19. But that shows you that, you know, just as we now have a vaccine protecting children from chickenpox and influenza so that we could bring these hospitalization numbers down, I think COVID-19 is very much in that same group. And this is another reason why we want to bring a vaccine for this group. Just like we've reduced hospitalizations with these 2 age groups from where they were, children have a similar rate of hospitalization for COVID-19, and we want to have the same benefit of a vaccination to protect them. If we look at deaths per year for these different illnesses that can be prevented by a vaccine, again, looking at years before these vaccines were available for children, so rotavirus, rubella, chickenpox, meningitis, and hepatitis A, this is the number of deaths on average we saw per year. And for at least these 4, we routinely vaccinate children. We routinely vaccinate children to meningococcal. This is done in grade 7. Chickenpox in age 0 and 4, rubella at age 1 and 4, rotavirus happens in the first 6 months of life they're vaccinated. You can see these are less deadly infections than the COVID-19 infection has been for children. And we vaccinate to make sure we prevent these deaths. And that, of course, makes it even stronger an argument for why we should be vaccinating to prevent deaths amongst the children who may get COVID-19 infection. And looking at the US data, this is the top causes of deaths for children 5 to 11 years of age. And if you take 6 deaths per year for COVID-19 in the US, that puts COVID-19 as the 8th leading cause of death for children in the United States in the 5 to 11 age group. And of course, with a vaccine, we can drop that way down this list. And so that's another reason, of course, we absolutely want to get that vaccine for these groups. And so I think there's a really strong arguments for why we want to make sure we're going to be vaccinating that 5 to 11 age group going forward. You know, Pfizer's vaccine proved to be on the order of 90% plus effective against the COVID infection. So that's great. We have a very effective vaccine. But I think the other thing that's really interesting is that this vaccine is quite safe. And so this is a bit of a detailed slide, but I thought this audience would be pretty sophisticated so I could explain it. So I'm just going to, focus in here. This is an area that's looking at redness at the injection site as a side effect of what the vaccine might do. We have the 5 to 11 age group here. They've listed 5 to under 12, but that's basically 5 to 11. So the group who's going to become eligible for vaccination. And they're comparing it to age 16 to 25 just as kind of a comparison. And we're looking at the vaccinated group, the placebo group here in the 5 to 11s, the vaccinated in the placebo group in the 16 to 25 age group. And you can see, if you get the vaccine, you're more likely to have redness at the site of the injection than a placebo. The 5 to 11 age group, even with that placebo, they're more likely to have a redness reaction. And it does seem like they get a little bit more of a reaction of redness than did that 16 to 25 age group. So the vaccine does seem to cause a bit more redness at the site of injection. If you look here, it's causing a slight bit more swelling at the site of injection. But actually, it causes less pain at the site of injection than it does for the 16 to 25 age group. So it's kind of a wash here that in terms of the site of injection, yeah, these young children may get some more redness and swelling, but they're going to actually experience less pain from the injection. So it's sort of a wash in terms of that local reaction. But what becomes really interesting is when we go over to this slide. Now, this is set up a little differently. We're looking at the vaccine in the 5 to 11 age group versus the 16 to 25 age group, and all of these different side effects that can occur. And what's really significant here is that you can see the 5 to 11 age group, much lower incidence of fever, much lower incidence of fatigue, of headache, of chills, lower for vomiting, lower for diarrhea, lower for muscle pain, lower for joint pain. Overall, it looks like the 5 to 11 age group, the vaccine that they're going to be receiving is going to have fewer side effects and less intense side effects than the vaccine that we all got as older adults and youth got as the 16 to 25 age group. And so I think we're both getting an effective vaccine for 5 to 11-year-olds, but we're actually getting a vaccine that looks like it's going to have fewer side effects and be actually a little bit safer for that youngest age group. And I know a lot of parents are, wondering about the safety of the vaccine and getting it for children. I think the scientific data here is really luckily showing us that we actually have an even safer vaccine for these children. And yet it's still 90% effective, and it's going to hopefully prevent them from the severe outcomes from COVID-19, and of course, prevent them from the disruption of having to isolate, missing school, all of those outcomes. Good news as well is that Canada is about to receive 2.9 million doses of Pfizer, which actually will mean we'll have enough doses within a couple of weeks so that we can vaccinate every single child in that 5 to 11 years of age with at least one dose. Now, we know not every parent is going to bring their child forward, so we're going to have leftover doses that can go into a second round of second doses for those children. But if every single parent brings their child forward, we are going to have enough doses. So vaccine supply is not going to be an issue for us. We're absolutely going to be able to vaccinate all of these 5 to 11-year-olds. And I think I'm really excited and looking forward to being able to vaccinate them, because that is the group, as I showed, where the infection is spreading the most right now. And we have an opportunity to actually bring that risk right down for them, which will hopefully actually bring cases down for our entire community. And of course, keep our children safe and keep our children able to continue in school uninterrupted. So that's, I think, going to be the big story in the next couple of weeks of what we're going to see, where we hopefully get approval for that vaccine and start that campaign. And I'm hoping that we can actually be done a first dose for every child whose the parents bring forward by the time Christmas time rolls around. So when we have those gatherings around Christmas time, when we have the big family dinners, unlike Thanksgiving, children will have at least one dose of vaccine by this point so that they'll be better protected. And so we won't see as much of an uptick of infections when we come out of the Christmas holidays that we saw around the Thanksgiving holidays. So I'll stop there and I'll turn it over to Mishka to lead us through the questions.
Yes, thank you so very much, Dr. Hirji, for your update. And I especially wanted to thank you actually with your focus on the younger population, because as you had mentioned in your update too, it has an impact on all of us and has an impact on employers, has an impact on staff, has an impact on parents that are caring for them. So this focus for today's discussion, I think it's critical. We've had a couple of questions coming in via the chat on exactly that particular issue, but I think you have addressed them because people are asking specifically, when can we expect the vaccine? And I think for the younger population, and I think you're indicating that that population is likely has their first shot by the time the holiday are coming around. That seems to be about the right time. Am I right?
Yes, it is. So, it's with Health Canada to approve the vaccine. As soon as Health Canada approves the vaccine, Pfizer is going to then ship the vaccine over to Canada. So we're just waiting on whenever Health Canada approves it. My understanding is that approval is imminent. In the next couple of weeks, we should have that. Vaccine will then flow very quickly. So I imagine by early December, we will be having clinics to vaccinate. Possibly even by the end of November, in the last couple of days, we might even be able to start by then. So we'll have to wait and see what happens, but I expect that, within 2 weeks, we will actually hopefully be able to start vaccinating that group. And that'll give us enough time that there'll be enough appointments for every child to come and get that first dose before the Christmas holidays.
Well, that sounds excellent. I was wondering if you can elaborate a little bit on what the rollout will look like, because I think that parents and employees are wondering, is this going to happen in schools? Are we going to have more clinics that are opening up? Are they going to go to their own family doctor for that? How are you planning to roll it out? And it's probably something that helps people having conversations with their children at the same time.
Yeah, so there's going to be basically 3 principal channels for rolling out the vaccine. The biggest channel is going to be us in public health running clinics out in the community. Now, the locations of our clinics aren't going to be the same as we had previously. Previously we did our mass immunization clinics at some of the big sporting community facilities across the region. Sadly, they have resumed I shouldn't say sadly, they've resumed their normal activities, which is certainly very good for our community and for the owners of those places. They're back earning revenue for their operators, but sadly that means we no longer have access to use those centers. That being said, they're also not necessarily the best centers. If I take, say, the Meridian Center in Font Hill, that was a clinic where we could do 2,300 people a day with vaccinations. It was a huge group that we could vaccinate. But if you have that many children going through that area, children are going to be anxious. That crowd is going to make them scared. Some child is going to start crying. And of course, once one child starts crying, everybody else is going to start crying. It's perhaps not really the best environment. So it is maybe a slight blessing that we're not going to be using those big centers. So we're going to have smaller clinics around the region, which are going to be a little bit more controlled. So hopefully we won't have quite that rush. It'll be a little bit more comfortable. And we're actually doing a lot to tailor those clinics to children. We're going to actually have a new logo that's for children that looks fun with a superhero fighting off the virus. We're going to have videos and movies playing, so when children are going through the clinic, they can be distracted. So they're thinking about some fun movie as opposed to thinking about getting the vaccine. We're going to have some distraction toys for them so they can, have their attention focused on something else. We're really going to try and make it as good an experience for them as we can. So that's the first channel, the public health clinics. A secondary channel of getting vaccines is actually going to be through primary care. I think parents are used to taking children to their family doctor to get their vaccines. Many children have appointments with their family doctor relatively recently. And so we want primary care, and we're working with them to make sure that they're able to vaccinate, because that's actually probably going to be the preferred option for a lot of parents. In a survey we did, about 20 to 25% of parents said that that was their preferred place to get vaccinated. So we're definitely going to try and enable family doctors to be able to deliver it. And then finally, pharmacies are also going to be available to deliver vaccines. And we have 150 plus pharmacies around the region, I think, who are doing COVID vaccination. So there's lots and lots of different options out there that there's hopefully really convenient in your community. So, between public health, primary care, and pharmacy, there'll definitely be lots of options to get vaccinated.
Excellent. And I want to take one last question, actually, when it comes to the vaccination of our youth. And this is a question that's asking, Johanna is asking, are the majority of positive cases ages 5 to 11 symptomatic?
I'd say the majority definitely are symptomatic, but there's a significant number who don't have any symptoms. I want to say, kind of ballpark, it's probably 20 to 30% of children don't actually have any symptoms. So, the lesson from that is, of course, if your child has symptoms of infection, please do get them tested. We now have testing that's actually less invasive, so it's going to be less painful for children. And that way we can make sure we find infections early and we stop the spread of infection and protect everybody in the household. But secondarily, it does mean that there are always risks of asymptomatic people spreading infection, which is why we still encourage children to wear masks when they're out in the community, when they're in school, to make sure that they can stay safe. And of course, the vaccine will be the other way that we'll hopefully soon be able to keep them safe as well.
All right. Thank you so very much. I'm going to shift slightly the conversation to a couple of questions that also have been submitted to us, and I think that are really critical to a lot of individuals, because we have families on both sides of the border. And this particular one is a question that Jim had brought in and had submitted. When do you see the need for the expensive PCR test to re-enter Canada being reduced or eliminated? And there has been a lot of questions around that, the PCR testing requirements, and if they can be lifted at border crossings. And he, and along with many others, actually, and us as well, would love your insight on that.
Mm-hmm. So I unfortunately don't have any insight in what the federal government's thinking is around that. They're ultimately going to make the decision of what the border rules are. I will flag that I do think there is value to the testing, at least for the people who stay across the border for extended period of time. We are pretty much every day picking up an infection from someone who's crossed the border from the US. So there definitely is, risk when you cross the border. There is a lot more infection spreading in the US who has not done as good a job as us as controlling the pandemic. And people are bringing infections back. And that test is useful to pick up those infections. I think there's a good point that, if you're doing a short trip of a few hours or maybe 24 hours across the border, you can get a test in Canada, across the border, show the test that you got before you even did your travel. It's perhaps not doing as much value there. I think it is kind of useful as a reminder that there's risk when you cross the border, that it's not back to normal when you're crossing the border, and hopefully it's a flag to people. But I think that maybe there's some opportunity where we can adjust that testing requirement. And I might suggest that rather than you show a test across the border, you need to maybe get a test after you've come back across the border a few days later to make sure you didn't pick up infections, so we can be sure of that. But ultimately, these will be rules decided by the federal government.
Very good. There's a couple of questions also related to the government of Ontario announced that it will not require vaccination of healthcare workers, although the Niagara health system will require it from January, I believe, onward. What are the likely consequences of this decision, and will it impact any services that we can expect when it comes to healthcare services?
Sorry, could you just repeat the first part of that? My audio glitched.
Yeah, actually, no, the government of Ontario announced that it will not require vaccination for healthcare workers,
Right, yeah.
whereas the Niagara health system will require vaccination from January onward. And so a couple of individuals have reached out to us wondering what impact it will have on those ones needing to access the health services of Niagara.
Yeah, so my expectation is this will have only a positive impact for us in Niagara trying to access health services, because when we show up at the hospital, when we show up in the emergency department needing care, we can be sure that they have done everything to make sure that we're not going to pick up COVID-19 from a staff person who is unvaccinated in the hospital. I think it's a really good move that Niagara Health has made to show commitment to patient safety, and I really support them in making that decision. I think voluntarily, when they didn't require vaccination, they already had a pretty high uptake in vaccination. And this is just going to make sure it gets to pretty much 100%. So I think it's really good news. I think there's lots of worry around, some healthcare providers choosing not to be vaccinated and leading to some staffing issues in healthcare. I don't think it's going to be huge. I think the number of healthcare providers, at least in Niagara, that I've heard of who are choosing not to be vaccinated is quite small. I showed you that the general public, 85% of people have chosen to be fully vaccinated. I think that percentage is going to be even higher amongst healthcare workers. So I think it's going to have a pretty minimal impact on the capacity of the healthcare sector, but it's going to make sure the healthcare sector is safe for us when we access it.
That sounds great. One of our participants today, and Trudy, is asking, and I think it's a great, very timely question, will the recent Public Health Agency of Canada comments on airborne transmission change public health guidelines around indoor masking and distancing? A lot of workplaces are basing their return to work on a 2-meter distancing, and people and staff do not have to mask if they're at least 2 meters from core workers. Will that change, and should it?
Yeah, I don't expect much to change because of this. I think there had been a fair bit of public understanding that COVID-19 was spread through the airborne route. In past weeks, I've shown a graphic when I've talked about workplace safety, which shows the virus spreading through both droplets and through the airborne route. And that's really factored into our guidance as we've given public health to others for quite a while. So I think the advice isn't really going to change. 2 meters distance, while it works less well when we're dealing with aerosol transmission, still does work. If you're thinking about a source point for aerosols coming, the closer you are to that source point, the more concentrated that aerosol will be, the more virus could be in that aerosol. As you get further away, there's going to be less aerosol, and there's more opportunity for a good ventilation system or a good filtration system to maybe pick up some of that virus and actually remove it from the air for you. So 2 meters distance still is a useful thing to prevent the spread of infection. It's not as perfect as it was when we had we thought it was droplet prevention, but it's still going to make a difference for aerosol prevention. I still think it's the sensible thing for businesses to do to try and space people apart, because that lessens their risk. And that combined with masks, I think, is going to give a good protection. And of course, vaccination and having a good ventilation system are the other important pieces of keeping your workplace safe.
Yeah, thank you very much for the clarification on this. There's a question that has come in, and I think we often look at it, although we are focused on Niagara, we're focused on Ontario numbers, but we also have to look at it and saying that we're a global community, and only 41% of the world's population is fully vaccinated now, with many countries in the sub-Saharan Africa, for instance, having vaccination rates in the single digits. Does this substantial pool of unvaccinated people pose a threat to world public health? For example, the opportunity for new variants to evolve that could be vaccine resistant? And I think it's an interesting question, because our eyes are more focused now on travel, of reestablishing supply chains and other areas of it, that we really are looking at it and from a broader perspective, and maybe not as narrow in some cases. And I think it's an excellent question from one of our participants.
Yeah, it's an excellent question. I 100% agree with this individual. There is significant risk if COVID-19 keeps spreading in other countries. You know, the variants we've had, the Delta variant emerged in India because COVID-19 was spreading uncontrollably there. They weren't vaccinating their population. Actually, India at the time actually is one of the biggest vaccines producers around the world. They were producing vaccines to sell the rest of the world and not vaccinating their own population, which let the infection get out of control there, and we had the Delta variant emerge. And I think as long as the infection is spreading uncontrollably, that's going to mean we're going to have new variants emerging. It's going to mean that, you know, people are going to be getting sick in those countries, which is going to disrupt the supply chains, as you mentioned. It's going to mean when we visit those countries, there's going to be a very high number of infected people around us, which is going to still put us at risk, because no vaccine is 100% perfect. And the more people around us who are infected, the more we're going to be at risk of still getting infected ourselves if we're traveling. And of course, just morally, you know, people are dying from this infection every single day. And people are going to be dying in the countries where they have not had the opportunity to get vaccinated. And I really think one of the things we should be focused on is making sure we get vaccine to these countries, especially to sub-Saharan Africa, where I think the vaccine uptake is right now around 6 or 7%, to make sure they can actually get vaccinated, they can be protected, and we actually bring this pandemic to a close across the entire world.
Thank you. There's a couple of questions that are related to booster shots that have come in. One of the first questions that actually was submitted to us is that on your last call in October, you spoke about vaccine boosters. Mm-hmm. Do you recommend that the third shot for people who have received 2 AstraZeneca vaccines? So they basically are saying, and this is really interesting, it's coming down to the type of vaccine, the type of shots that individuals have had. And do you recommend a booster shot for some of them, maybe not all of them? So I think there's been a lot of news in the media too, a lot of attention being paid on this issue, onto this issue. So we'd love your feedback on it.
Yeah, so if you had 2 doses of the AstraZeneca vaccine, it is recommended that no matter what your age is, 6 months after that second dose, you do get a booster dose with an mRNA vaccine, either the Moderna vaccine or the Pfizer-BioNTech vaccine. We've seen the AstraZeneca vaccine gives very good protection against severe illness, but it's not quite as good as Moderna or Pfizer for at least preventing some milder symptomatic illness. And we want to make sure everybody has that protection, and because that, of course, means they don't have to experience being sick, but also it means that they're less likely to get infected and be able to spread infection to others. And so we're recommending that if you've had 2 doses of AstraZeneca vaccine, at 6 months, come back and get a 3rd dose, which is going to be either the Moderna or the Pfizer-BioNTech vaccine.
Overall, we are seeing that the Ontario government is recommending actually for individuals in the older age groups to get a booster shot. Are we anticipating that everyone is supposed to get a booster shot down the road, or what are your thoughts on it?
The sense I'm getting is we're probably headed in that direction. I don't know what the timeline of that is. You know, definitely Pfizer, Moderna are putting applications into Health Canada to get approval that they can do booster doses broadly. The recommendation right now isn't there, but I can certainly see that maybe coming down the road. I personally am not a believer that the booster doses are that important for most people. We see a little bit of waning in people who are 70 years of age and older, but we're not seeing much waning in other age groups. And we're seeing actually virtually no waning for people who got their 2 doses 8 weeks or longer apart. And that actually was most of us. Most of us got our 2 doses farther apart, and that has actually led to protection that doesn't actually wane. And we've definitely not seen waning for severe illness across any age group. So I really believe that we should focus on getting the unvaccinated people to get their first and second dose, because that's going to make a bigger difference than getting booster doses to people who are already fully vaccinated. And I also want to try and prioritize getting more vaccine to the developing world, to countries which we just talked about, where they have low vaccine uptake, because a lot more lives are going to be saved doing that than doing the booster doses for us. If we actually got everybody in Canada to just get the 2 doses of vaccine, even if it's just 2 doses of AstraZeneca, this pandemic would basically be over in Canada. It's because we have pockets of people who are unvaccinated, either because they're choosing not to be vaccinated, or with the other age 12 because they can't yet be vaccinated. That's why the pandemic's still persisting right now in Canada.
Very good. There's one last question on the same topic of booster that has come in from Maggie, who is one of our participants today. How long after the booster is the immunity increased?
We don't know the answer to that. This is something you can't really predict. It's, you give the booster dose and you watch over time what happens. What we do know is that when you give the booster dose, people's immunity jumps back up to where it was after their second dose, and in many cases actually better than they had after their second dose. And at least for a few months, it remains up at that level. But we don't know yet how long it's going to last. It's only with observing people over months or even years we're really going to know that for sure.
Yeah, very good. Interest has grown in recent weeks over 2 new antiviral pills that may reduce the number of people who become severely ill with COVID-19. While those 2 drugs aren't yet approved, Health Canada has authorized a handful of treatments called monoclonal antibodies that can reduce severe illness when given to people within a few days of symptoms and that are onsetting. Can you give us some clarity? And I think this is one aspect of how this is developing, what we're anticipating in months down the road. And I was wondering if you can speak to that.
Sure. I think we've had a lot of focus, and I think rightly so, on vaccines. And we have 4 vaccines approved by Health Canada. Health Canada has actually also approved 4 treatments for COVID-19 infection. One is an antiviral, so kind of like an antibiotic, but it goes against a viral infection. And then 3 are these monoclonal antibody treatments, where basically you're injecting antibodies into a person to help trigger the immune system to help it fight off the infection. The monoclonal antibody treatments are really interesting. They are an IV treatment, so they're not the easiest treatment to receive right now. They're between 30 to 80% effective, so they're not as effective as the vaccine. The vaccine is 90% plus effective, and they're also a very expensive treatment. So they've not gotten as much attention for that reason, because harder to administer, much more expensive, not as effective as the vaccine. The vaccine is still our first line of protection, but absolutely, we now actually have a clinic that we are working with in Hamilton that is a monoclonal antibody clinic. When we see new persons diagnosed with COVID-19 infection, and we see them as, because of their age, because of underlying medical conditions, they're high risk for maybe becoming hospitalized, we actually send them a referral to go to that clinic and get that monoclonal antibody treatment to hopefully prevent them from getting that severe hospitalization. The good news is, with these 2 new treatments that are coming forward, these are actually now going to be pill treatments. So you're not going to necessarily need to go to a hospital treatment. It's going to be, again, much cheaper to administer those treatments. So it's actually going to be another real big improvement in treatment for COVID-19. But again, these treatments are 90% effective. The vaccine is 90% effective. And just like if you, get an airbag in your car to keep you safe, that doesn't mean you stop wearing your seatbelt, or you start speeding on the road, or you stop putting winter tires on. Vaccine is our first line of protection. It's great. Now we're going to have these medications as a second line protection. If unfortunately we're the unlucky ones who still get infected with the vaccine, we'll now have something else to make sure we don't get severely ill. And it's just going to increase our suite of things that help us keep COVID-19 under control and end this pandemic.
Yeah. Thank you very much. And there has been a lot of attention on that. And I think it's good for us even to seeing how the treatment of this is actually evolving and what we can anticipate as we're moving forward. There is one of the steps that a lot of workplaces have put in place has been the rapid antigen tests of their staff. Should a business with an entirely double vaccinated workforce still use the tests? What are your thoughts on it?
Yeah, this is an interesting question, and I don't have a strong recommendation one way or the other around this. You're much less likely going to have infection showing up in your workplace or spreading in your workplace with a fully vaccinated workforce. So, the value of that rapid antigen testing is much lower, but it's not zero. There's always the potential that someone is unfortunately still going to be infected despite being vaccinated, bringing it into the workplace. It's probably not going to spread very far. It's going to fizzle out, but maybe you want to even prevent that small amount of risk. There's also going to be persons who can't be vaccinated. They have a medical condition or something that prevents them from being vaccinated. Or you could be in a workforce where you actually have some children who are volunteers and they, of course, can't be vaccinated. And so you might want to have the rapid testing for them. So, I would say the value is a lot less for rapid testing, but it's not zero. And I think every business needs to make a decision of how much do they want to go that extra mile to remove that residual risk, and taking account, of course, just the kind of logistics and burden of having to do the rapid antigen testing.
Yes. You know what has been really interesting on our end? We're one of many chambers across Niagara and across Ontario that are offering the rapid antigen test distribution to employers. And the uptake has been enormous. It has probably tripled like in the last month or 2 months for employers. It's really been really interesting. And the ones that have been repeatedly coming back and reporting on it as well. So we are extending the program. We are making it available because of the high demand of all different groups that are there. So I think it is being perceived as another sense of I'm a responsible employer, I'm keeping people safe and at least knowing what to anticipate. So it's been very interesting on our end to observe.
Yeah, and it's great so many businesses are taking that extra step to make sure they keep their workforce and their customers safe.
Yeah, I think so too. And that the government is making those tests available at a zero charge to employers too, because it's expensive otherwise for individuals to do them as regularly as they do at the same time. The government, and this is always a question that's important to businesses, the government had announced a roadmap to essentially a full reopening by the end of March 2022. And business likes certainty, they like to know what to expect. Is this likely to go according to plan?
I don't think it's going to go quite according to the timetable that they have laid out. I think we saw the announcement, I guess it was last week, where they put a pause on the next step of reopening, which was lifting capacity limits for a few areas where they're still in place. They've, of course, paused that. Cases are on the rise right now in Ontario. So I don't expect that we're going to have the pandemic completely under control come January 17th. And I expect that requirement for vaccine certification does need to be extended for a period of time. I kind of feel the government should realize this and be communicating that out to create exactly the certainty that people would have, that they could feel that, yes, don't expect anything to happen on January 17th. But of course, we're not seeing that from them. My prediction, though, is it doesn't end on January 17th. It's probably going to be the spring or early summer before we can see that completely lifted.
Yeah, and it's good for us. And I think we will repeatedly actually keep our eyes on this trend as well, because it's always so critical to business to knowing and to employees to knowing what to expect at the same time. The Ontario government introduced the vaccination certification app that is there. And we have found that a high number of the establishments who have put it in place are still seeing a very low uptake on it from customers that are there. And I was wondering if you can speak to that, or if there's anything that businesses need to do to increase it. But any thought on that would be appreciated.
Yeah, I think it's probably a victim of the timetable of which the province did things. That app came out a month after vaccine certification started. So everybody had downloaded their version of the vaccine certificate onto their phone or printed it out, and they've just kept doing it. And you've needed people to be really motivated to go back and re-download it and reprint it out with the QR code. And that's probably what the barrier there is. I personally think the QR code is great, especially if you have an iPhone, which I do for my personal phone. You can actually put it into your Apple Wallet. So it's right there with, a couple clicks of the finger. You've got it. It makes it super easy to pull up that QR code. And I think it makes it really easy on the end of a business person, where you're not reading their, vaccine receipt, trying to interpret it. You just scan it and it gives you the big green check mark to let you know the person can enter, or a big red X that they can't enter. I think, the role for businesses would be really just to keep promoting it, remind people that this option exists and that it's actually easier for everybody to do. And if we get that information out, hopefully more people will choose to download that version of the receipt with a QR code.
Yeah, thank you very much. There are a couple of questions related to the holiday seasons coming up. We're seeing our numbers slightly go up, but at the same time, you shared with us excellent numbers when it comes to outbreaks in food services, for example, places that a lot of people are going to and enjoying their colleagues, enjoying their family and other areas of it. Anything that you would say as we're going and entering the holiday seasons, and the social gatherings usually increase during that time with family, but also with colleagues at the same time? Any thoughts on that?
Yeah, so first off, I would say any gatherings you have, keep it to people who are fully vaccinated. Now, if you're going out to a restaurant, that's basically required, so that's great. If you're having the gathering in your private home in a hall that you've rented, hall re-rented, actually, there'll be vaccine certification there. So it's really in a private space where you're holding. Try to limit your gatherings to just fully vaccinated people, because that's going to make sure that that gathering is safe. Remember that there are still some, I think, capacity limits on gatherings. You can only have 25 people for an indoor gathering, 100 people for an outdoor gathering. You're probably not doing outdoor gatherings, so 25 people indoors. So be mindful of that for any gathering you hold in your home. If you have any children, if they are in the children who are between the ages of 5 and 11, please do get them vaccinated as soon as you can, so that they actually also have the benefit of some protection from the vaccine when you hold those gatherings. And then the last thing I'd say is that if you are having a large gathering where you're not consuming food, try and space people out, wear masks, just to increase that level of protection while you're having a gathering. Obviously, if it's a dinner gathering, you're going to be taking your mask off, and that's totally reasonable. And then you're relying on everybody being fully vaccinated to keep you safe. But I think if you follow those simple guidelines, you should be able to have pretty safe gatherings this Christmas.
Excellent. We're coming, I never know where time goes in our conversation, but it flies by. So we're coming close to the noon hour. And Dr. Hirji, I always love giving you the last minute for some closing comments, maybe things that you've thought of bringing up that maybe weren't raised during the question period, but on the back of your mind. So over to you.
Yeah, so the big thing on the front of my mind right now is vaccines for 5 to 11-year-olds as soon as we can get them out. And really encourage everybody to hopefully sign up your child to get vaccinated as soon as the opportunity arises. I hope I've given you enough information to show you the vaccine is safe, it's effective, it's going to really make a real difference for these children going forward. I think we need to keep doing everything we've been doing to keep the pandemic under control, make sure that this increase in cases flattens out and starts to come back down. And that means, again, promoting vaccination, continue wearing masks, continue to practice that physical distance. In our workplaces, keep doing the rapid testing if we have, especially if unvaccinated people in the workplace. Make sure we improve our ventilation systems. All of that is really making a difference, and is why we're not really seeing any kind of closures right now. And then lastly, I do think, we may need to tweak some of the limits in society a little bit, depending on where cases go. So there could be some new restrictions that might be needed. And I'm thinking particularly around athletic facilities, capacity limits, especially in change rooms where, lots of people are now concentrated in one area. Some of those kinds of requirements might need to be reintroduced, but I'm hoping that's the extent of what we're going to see to get the pandemic back under control in the next little while. And hopefully those will also be short-lived, that once we have the 5 to 11 group vaccinated, there'll be again opportunity to start to lift things again.
Excellent. Dr. Hirji, as always, thank you so very much for being with us. And for all of our participants and attendees today, we really do appreciate that you join us for our monthly webinars with Dr. Hirji. We have one more right before Christmas. I believe it's scheduled for December the 17th. As always, today's webinar has been recorded and will be available on our website at gncc.ca and will be emailed directly to all participants. If you have any questions or would like to directly get in touch with us, we can always be reached at info@gncc.ca. And so thank you all for joining us. Stay safe and shop local.